on excisional biopsy, this patient's lymph nodes were found to have atrophic or regressed germinal centers, plasmacytosis, hypervascularization, and occasional hyperplastic germinal centers. These are features in this constellation of features are consistent with a disease called multicentric Castleman disease. In this patient, you would call this patient the plasmacytic subtype. And that's because there's sheet-like plasma cells all throughout the lymph node, which is really something that you see in multicentric Castleman disease and a few other inflammatory disorders. Now, when you see these features, you can't with certainty say that this is definitely multicentric Castleman disease, because these particular features, this constellation, can also be seen in other diseases. It can be seen in lymphomas. It can also be seen in autoimmune diseases. So now that you have a lymph node consistent with multicentric Castleman disease, there's really two important steps. The first is to perform LANA1 staining to determine, is this lymph node, is it HHV8 positive or HHV8 negative, what we call idiopathic. That's the first step. The second step, whether it's positive or negative, is that you need to make sure to rule out the other diseases that can mimic it. If it's a positive LANA1 stain, it's less likely that there's something else, but if it's a negative LANA1 stain, you need to do additional stainings to look for Hodgkin's lymphoma. You need to do additional systemic laboratory evaluation for autoimmune diseases.